We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
I'd like to introduce myself as my name is Mezab and I came from Pakistan, and I'm the co-founder of Ban Asbestos Pakistan. And it's my honor to represent Pakistan on this 11th International Asbestos Conference. Thank you. You see in the picture my late uncle, who was also a Canadian national, was working in a DADX Ethernet Limited factory in Karachi as a chief maintenance engineer since 1999. While working, he got exposed and felt ill. The managing director and the management of the DADX, they kidnapped him and took resignation from him on gunpoint. And we had lodged a complaint in the police station as well, but after 6 months of that, he had died. We also knocked the Canadian embassies, I believe it's a high commission, but they didn't take any action against their citizen was kidnapped in Pakistan. But from that day in 2007, my father, Syed Ahmed, who's sitting there, started the movement, and we started knocking every doors of the government to tell them that asbestos must be banned and it's hazardous to health. We were regretted, and almost everywhere, DADX being a very multi-billion-dollar company and group, I believe, and they were very influential, but still we didn't lost any hope and kept on moving even though we faced some threats as well. Yes. Then in 2010, my father filed a petition in the Environmental Protection Tribunal, it's the lower court of Pakistan, for a complete ban on asbestos in Pakistan, the import, export, production, and use. The Honorable Tribunal constituted a commission based on 3 experts of Pakistan, basically scientists, to guide them about the hazards of asbestos and what it is. And eventually the DADX, they challenged it in the higher court that this case is not maintainable and we have the license, and the government of Pakistan has given them the permission for importing asbestos white chrysotile since 1985. When we provided the complete report along with the JPC report, which was emailed by Dr. Barry Kesselman to the court, and the Chief Justice of that court, he gave the decision through his judgment that this case is maintainable and it must be proceeded immediately because we have to save the people of Pakistan. After that, that challenged it in the Supreme Court, which is the highest court of Pakistan. But the Supreme Court also, they told the commission, the scientific commission, that you must provide us the report as soon as possible within 3 months, because this is a human rights case and we must look after it. And then the DADX group, they started their dirty works, like they threatened the senior most oncologist of Pakistan, who was a member of the team, and they threatened him and he resigned from the commission. The commission then finally submitted the report after 14 months, and but still, being a rich man, the DADX is not letting the court to provide its final decision. It's not working. Yes. I met Linda Reinstein in 2010 on Facebook and started sharing my movement and everything about the case, and she used to give me favorable advice time to time, and she was the first lady internationally. She was the first lady whom I trusted and shared everything with her time to time. With the support of ADAO, especially Linda Reinstein, we organized the first National Stakeholders Conference in Karachi on 1st February 2014 at Madrid, Karachi, where we arranged 170 high-profile guests, like there were some politicians, doctors, engineers, lawyers, labor union leaders, and many more. Sugio Fraya, who came from Japan, it was my honor that he came, and the conference was a huge success, and Pakistan was, at that time, got introduced in the world for the Ban Asbestos movement. We received several favorable messages for the success of this conference, and we had transformed it in our souvenir. Next. We then organized the World Asbestos Congress in Karachi on 31st January 2015, in which Linda Reinstein, she came all the way and trusted me, and she came, and along with Dr. Nico Van from Australia, Sugio Faraya from Japan, and Dr. Chui Yong from South Korea, they attended as our key speakers. And they were very helpful for us, especially for Pakistan, for our Pakistani community, that they guided them and they told them that asbestos must be banned here immediately. Next page, please. You can see in the picture in the Congress, we had invited few army generals of Pakistan, brigadier generals, vice admirals of the Navy, topmost lawyers, doctors, engineers, few senators, few members of National Assembly, members of Provincial Assembly. There was also a former health minister, business leaders, and it was the first time the industrialists had come forward for supporting the ban asbestos Pakistan. Next please. According to our survey with the senior most investigative journalist of Pakistan and his team, in Karachi, 2 million people are affected from chest diseases due to asbestos. And it is a big issue, and in Pakistan, we have investigated in different hospitals, and we found that there is no research, no counting, no data on asbestos-related cancer diseases or patients. Even our doctors are unaware of this mesothelioma or asbestos-related diseases. We decided that God has given us the opportunity that we establish a meso hospital and research center so that poor people, especially laborers who are working in the constructions, in other sort of industries, who are in cancers can be treated for free of cost, and there is no hospital in Pakistan where poor people can get any sort of treatments. The foundation of the world's first meso hospital was laid in the conference. Next page, please. Yes. After the success of the World Congress, we started receiving very positive response from our federal government of Pakistan, like the President of Pakistan. He supported us, the Prime Minister, the advisor of the Prime Minister on Foreign Affairs, the Federal Minister of Health, the Secretary of Health, the Federal Minister of Commerce, the Federal Minister of Education, the Federal Minister of Environment. They all have agreed that asbestos must be banned, and the main thing they have pointed out is asbestos awareness and education must be organized in Pakistan so that people may get knowledge and about asbestos hazards and its occupational diseases. We are also constituting a legislation for our parliaments, because we have to move it through our parliament to the Senate and then to the President of Pakistan, who will sign it for the complete ban. Next page, please. I took Dr. Nico Van to several hospitals in Karachi when he was there in Karachi. We found no asbestos patient, but when we visited the Naval Hospital, the Bahria University of Medical and Sciences, we found 5 to 6 mesothelioma patients brought every year who work for the Navy. Dr. Nico asked him that Navy retires their officers at the age of 55 and they go to their villages and die there without any diagnosis or treatment. These numbers are not listed. Next page, please. You can see the Dadex factory located in a residential area of 3 million poor people of Mangopir. It's in my city. Although this population is surrounded by many terrorist organizations as well, including the Taliban and others, Islamic extremists. Next page, please. You can see in the figure that according to the Custom Report 2014, Dadex Ethernet Limited had imported 455.015 M tons of white chrysotile in November 2013 from Russia, Novorossiysk Seaport, company name Florimond Limited, Russia. And they are still manufacturing this in a huge amount because they export their sheets and pipes to Afghanistan, Turkmenistan, Azerbaijan, Tajikistan, and all the Russian Federation countries. Next page, please. People of Pakistan have asbestos-related products all around their surroundings. It is surveyed also that 70% of them, they use asbestos on their sheets, and the drinking water supply of Pakistan is done by asbestos pipes, and we drink that water. Roofs are covered with asbestos sheets. Large number of asbestos sheets are installed in all hospitals, schools, colleges, universities, public places, and many more. So we are very hopeful that when the government of Pakistan accepts to ban the asbestos, a huge task is how to bring awareness and educate our people of Pakistan about the hazards of asbestos. Number one comes awareness, then diagnosis, then prevention, then compensation. It's a big issue for our lawyers. We must also educate our lawyers that how to help the victims to be compensated in Pakistan. Next. These photos were taken in 2007 by myself, and I went to the factory area, and you can see that Dadex has been spreading its waste material since 1950, and it has a 3 million population there, children playing on the waste of asbestos pipes and sheets, and these waste has become a mountain now. And I also want to share one thing is that Pakistan is also the second largest shipbreaking yard named as Gadani, and it consists of 22,000 poor workers who get $3 per day and there is no safety for them, and it's also a big issue. And as Bob has showed a video about the World Health Organization of India, you can also assume that Pakistan is similar to that. Yeah. And in the end, I'd like to thank Linda and Leo Williams for giving me the opportunity for supporting me. Whenever I used to get depressed, I used to write to them, and within 15 minutes after receiving their reply, I used to feel fresh, and I used to say, I won't give up.